Yes, good morning, and from Daniel. I, it's a very good morning here, and I'm yet to start work at the hospital. And I just want to show you how things at the hospital here are run. Uh, Pretty much how, just want to show you how my day at the hospital is like. So, straight to the video, I just want to show you this area. It's called the sample processing area. And this is where I receive the samples from the patients. And on their book, yes, on their book I get information from the patient's book and then enter them to the computer. And yeah, I'll look at the tests that are supposed to be done. And over here is where I'll sit the patient, and depending on the tests that are supposed to be run, I'll have to get them here. It's not yet fully equipped because the day has not started yet, but by the time, in just a few minutes, they will be reloading this part here. And yeah, so after that, there is a window that that the samples collected come through, and this is the area that we receive samples. And the processing area is here, depending on what has been requested. So for example, this is where they do malaria slide testing, where you have to put a slide onto this part, mount it there, and then view it, and then you can conclude the results. When you get the results, you record it. You just record it onto this computer here, right there, and that computer actually sends the results back to the clinical room. So those are not the only tests that are done here. We also do urinalysis as well, where we look at the appearance, we look at the chemistry part of it using a strip, and then of course you have to view it as well view it through the microscope. And then these are just like the wash-up areas, and these are just like the stains that are, when you want to do a specific, maybe let's say for example malaria slighted, this is where you have to like dip stuff. These are stains. Yes, and that's pretty much it. So this is, I can call it parasitology section. And over here, yes, just a minute please, just a minute. So over this part, this is where we do serology, where specific stuff are done, and there's HIV testing, there's malaria testing, and hepatitis, and HCG, that is for pregnancy, etc. And then yeah, after that we just record them to this computer right here, where of course where all these results are. And yeah, that's pretty much it about this station. And then going to this part here, to this section here, this is the hematology section, where this is like a CBC. This is like a CBC machine. It's a CBC machine there. Let me show you a few things here. So CBC machine, we have to input. We put blood here from a test tube collected from different tubes. You put it here and the machine runs it. And what it does, it gives you specific parameters of, of the components in blood, where we are looking at the white blood cells, the red blood cells, the platelets, the hemoglobin or the blood levels. And yeah, just after that, there is a computer here that you have to record results, and it will be sent straight away to the other side. So over here is also another machine. Is another machine called the electrolyte, human light machine. What it does is it measures specific components of electrolytes in. Let's say, for example, what we do is serum. There is we are looking at sodium, potassium, magnesium, and yeah, among many electrolytes that are in the body. And then over here is a chemistry machine, and this chemistry machine definitely it does what it does. It runs what we call, in short terms, LFTs and RFTs. Those are renal and liver functional tests. Yeah, and yeah, it's a pretty much big machine, and it does big stuff. And then over here is, it's a place called, it's a station called blood transfusion. Yeah? And in this station is where you find blood groups. You get where you have to run a few tests of the patient, and that of the blood unit that you're maybe going to issue out. And after doing all that, you can dispatch of maybe blood or gotten to know a blood group of a patient. So yeah, that is pretty much about this area. And over here is a store where batteries and books and some other files are kept. And yeah, that's it. And over here is also the manager's office, just here. These are refrigerators, blood refrigerators, sample refrigerator, and then reagent refrigerator. And going to the last section, this is now microbiology station. And over here is a virology machine and an EID. EID is early infant diagnosis. This is where that stuff goes on. Virology is where they have to determine what is going on, or how much, or the quantity of virus in you, at what extent has it reached, and stuff like that. Over here is the gene expert. This is where sputum is run. Sputum is right here. This is a machine that runs sputum. Of course, it's computer. And over here is as well the biosafety cabinet that where they put samples from sputum specifically, because it is highly infectious. So when you put it inside there, it absorbs the aerosols. Aerosols are just like very, very tiny, I mean, there's just things that evaporate there, water that very, very, it can't be visible to the eye, but this protects you from that. The risk of infection is small. So, and this place is where they do what we call ZN. ZN is a technique that is done to sputum so that you can find out what we call the acid fast bacilli. This is what goes on there. And yeah, that is pretty much it. That is also one of the stores here at the hospital. So yeah, that's pretty much what is done here at the hospital. And each and every morning, before I do anything, what I do is have to clean all the surfaces, and then yeah, make sure that things are in order before I start doing work. So you must have wondered why I've done this in the morning. So I may not be. It's not possible for me to. It's not possible for me to record videos during tests because I actually pretty much get fixed from morning to evening. So I carry out more like, I think minimally the tests I can do every day is 200 tests per day. That is like minimum. So I don't have time to record and show you how our stuff goes on here during a busy day, because everybody's just trying to make sure that they reduce on the patients that are waiting, and yeah, just get them fixed. And so this is all possible because I did talk to Brian, and I just want to thank Brian specifically. I want to thank God for what you're doing. You're doing a good job in my life, actually. And just pray that God blesses you, and Gracebound at large. May really God bless you. I am going to sign out right now, and thank you for sparing your time to look at this. Bye-bye. See you.